everyday life. It is my life.
Hi guys, welcome back to my channel. I'm Dr. Karen Amaniampong and this is Sweet Talks with Kay. Compliments of the season to everyone. Today I'm going to talk about my top tips for postnatal recovery. Congratulations on the arrival of your little one. You've had this little one growing inside of you for months and you finally get to meet him or her. This tiny little person who comes to steal your hearts right away. So the postnatal period is the period from delivery of your baby, in fact delivery of your placenta, right up until 6 weeks. For some, they're able to bounce right back and have a quick recovery in the postnatal period. But for others, it may be a slow, steady path to recovery. No matter how long it takes, just take your time. It's your journey and you know your body. So my first tip is about bleeding. Yes, bleeding. After the delivery of the placenta, which is the afterbirth, then there is bleeding, which is normal. The bleeding is usually heavier or a little heavier than a normal period, and it requires the use of a sanitary pad or towel. Panty liners or the normal pads are usually not thick enough to absorb this type of bleeding, so it's worthwhile to pack maternity sanitary towels or any special maternity panty which comes with inbuilt sanitary pads to absorb the bleeding. It's normal to have to change the pad every 3 to 4 hours in the first few days, and then as the days progressively go by, the bleeding reduces. Someone might ask, how long does the bleeding last? For some, the bleeding lasts from a few days to a few weeks, and as I said, it can last up to 6 weeks. And the other question I frequently get asked is, how will I know when the bleeding is my period? Or how will I know whether it's my period? So if the bleeding stops and restarts after a few days, it's likely to be your period. If you are unsure, you can consult with your doctor or your midwife. Some people also want to know, or the other common question I have is, how will I know, or how long will I not be with a period after I've experienced the post-delivery bleeding? So it depends on whether or not you are breastfeeding. If you are breastfeeding, then it takes a little bit longer for your periods to come back. Your periods you would usually resume when you reduce the number of feeds or wean the child. If you are not breastfeeding at all or you breastfeed less frequently, then your menstrual period will return a little bit quicker. So that's the first tip about bleeding. If at any point the bleeding suddenly becomes heavier than what it has previously been, if you bleed with clots, or if there's a change in the smell, as in it becomes a little bit offensive, or you develop a temperature, it might be a sign of an infection. So please report to your doctor or midwife if there is a sudden increase in the volume and the heaviness of your bleeding, or if there are clots, or if it's offensive, or if you're just unsure about what the bleeding is. The tip is about pain. Yes, pain. Most people think that there is only pain after cesarean sessions, which is surgeries done to deliver babies, but no, there can be pain after vaginal deliveries as well. So let's first tackle the pain associated with vaginal delivery. Deliveries of your baby associated with even a little vaginal laceration or tear, or episiotomies, which are the cuts done to help with the delivery of the baby, or a third degree or a perineal tear, usually come with pain afterwards. So having a vaginal delivery does not necessarily mean that you'll be pain-free. You will be given analgesia when going home to help you deal with the pain. So do try to take the pain relief or the painkillers regularly. Taking pain relief or painkillers doesn't mean that you are weak. The other source of pain after delivery is when you have a cesarean section. So the wound from the cesarean section usually gives pain, but you are not sent home without any pain relief. So stay on top of your pain medications, stay on top of your pain Take your pain relief or analgesia regularly. Don't wait hours and hours later, then you now remember that 10 hours later, oh, I should have taken my pain medication. By then, the pain is very, very severe. Usually, the pain relief you are given to take home with are enough to help you deal with the pain. Another way to cope with the pain is to avoid sharp movements right after you've come back from the hospital, because doing sharp movements will usually aggravate the pain and make it worse. Another way to avoid or to cope with the pain is to avoid lifting objects which are heavier than your baby, especially if you've had a cesarean session in the first few days. So lifting things which are a little bit too heavier for it. So I use the example of heavier than your baby, because you have to carry your baby. So anything heavier than your baby might be a little bit heavier or a little bit too much for you. So lifting very heavy objects, especially in the first few days and weeks after a cesarean session, might put pressure on the wound and cause you more pain. So just try to take it easy, avoid sharp movements, and avoid lifting heavy objects. My third tip is about wound care. So again, the wound care doesn't only cover wound care for cesarean sessions. Remember that during the delivery of your baby, you might have lacerations or tears or an episiotomy, which is a wound which needs taking care of. As with the basic principle of wound care, all wounds should be kept clean and dry. Clean and dry. So with the episiotomy or vaginal laceration or tear, try to keep it dry and clean. Good hygiene in the vaginal and perineal area is important, and also it's important to keep the cuts in the perineal area dry. So after bathing, you can pat the area dry. With cesarean sessions, you might have a discharge, or you might be sent home with a plaster, and beneath the plaster is your wound. Your wound might have been closed with absorbable sutures, which means sutures that don't need to come out, or non-absorbable sutures, which means that there are stitches that you have to go to the hospital to have them removed. Some hospitals use glue to do the closure. Just listen to the instructions you are given concerning the care of the wound when you go home. Ask questions. Ask what type of materials you have. Ask when your follow-up is. And when you are given an appointment for follow-up to check the wound, do follow up on the wound. And again, just like with all wounds, the basic principle of keeping it clean and dry apply. If you're sent home with a plaster, listen to the instructions, follow the instructions. Do not take it off before the time you are told to take it off. And if it does slip off, you can always go back and have them check on it and see if they need to put the plasters back on. After the plasters come off, still the same principle, keep it clean and dry. No vigorous rubbing after bathing. The wound should not be vigorously rubbed. You just need to keep the wound clean and dry, and drying by gentle patting should be enough. So my next tip is about exercise. Yes, exercise. So after you've had a baby, you might want to resume or restart exercising. If you've had a vaginal delivery, it's usually easier to reintegrate and start to exercise, or if you've never exercised before, it might be a little easier on your body. But if you've had a cesarean session before, it might not be advisable to immediately want to run a marathon. So the principle for resumption of exercise, whether for a vaginal delivery or a cesarean session, is to ease your way gradually into it. So it's little movements frequently. That's the principle. Do little movements frequently to ease your way back into it. The last tip I want to talk about is mental health. Yes, mental health. Having a baby can be very difficult for some or for most. It's completely adjusting your life and having this little person who is totally dependent on you for their every needs. It can be emotionally and mentally tasking for some. It's okay to ask for help from others, new moms, it doesn't mean that you're lazy or you don't like your baby. And if you do visit a new mom, also offer them support and help. Go visit them with cooked meals. When you visit them, offer to change a diaper. When you visit them, offer to look after the baby while she showers, because trust me, some might not even have the time to go in the shower, even something as little as a shower. Or just ask them how you can help them, so that they can even put up their feet for a few minutes, because trust me, putting up your feet for a few minutes really helps you deal better, and it feels so good. So offer new moms help, and new moms also ask for help. The sleep deprivation is real, trust me, and it can take a toll on your mental health. Rest while the baby is resting. Sometimes it's quite tempting to do chores while the baby is resting, like I need to clean the bottle, I need to clean the breast pump, or I need to wash, or I need to cook. But rest while the baby is resting. It's really not easy, but rest while the baby is resting. If you notice that you are continuously moody, it doesn't change. It's normal to have mood change after your baby is born, but if you notice that your mood is continually depressed, or you are beginning to have harmful thoughts towards your baby, it might be a sign of postnatal depression, which is not uncommon. So talk to your healthcare provider if you experience any of this. And if you notice that any new moms have a recent or new change in behavior, which is different from what they usually exhibit, just take the time to find out how they are feeling, ask them questions, and if you think they need to talk to somebody, help them out with that. It can be difficult to admit that you need help in that aspect, and most people find it surprising that they have even developed postpartum depression, but it's quite common, and know that you are not alone in all this. To conclude, there are some general things to look out for, general signs to look out for in the postpartum or postnatal period. I'll just mention a few of them. It's not uncommon to find people developing clots in their legs or their lungs, like a pulmonary embolism or a deep vein thrombosis. So if you notice that you have new onset of shortness of breath or pain in your legs or your calves, or swelling in your legs or calves, it might be a sign of deep vein thrombosis or pulmonary embolism. Other warning signs in the postnatal period, I've mentioned already: heavier than usual bleeding, or heavier than the normal, or with clots. Any change in the smell of the blood. Also, any pus draining from any of the wounds, whether the cesarean section wound or the cut or the episiotomy. Any increase in pain, not responding to analgesia, or pain that is quite different from what you've been feeling in the last few days. Any fever, any sign of feeling generally unwell, do consult your healthcare provider. So these are my top tips for postnatal recovery. If you have any tips that help during the recovery period or during the postnatal period, please share them in the comments section. And if you have enjoyed this video, don't forget to subscribe if you've not subscribed, to like and share with new moms or anyone who you think might benefit from this video. Thanks for watching, and bye-bye.